Hello, I'm Dr. Joanne Mosseri, and I'm the Dean of the University of Portland School of Nursing. It is my pleasure to welcome you to the School of Nursing. We are standing in the new addition to the Learning Resource Center, where our high-fidelity simulation takes place. As a nursing student, you will be participating in many simulations, as well as spending lots of time in the Skills Lab. But first, let me tell you about the School of Nursing. We just completed our 80th year as a School of Nursing and continue the mission of the Holy Cross to educate the minds, the hearts, and the hands of future pilot nurses.
Hi there! My name is Elisa Majors and I am the Undergraduate Program Counselor for the University of Portland School of Nursing. I want to thank you for listening to our online information session regarding our BSN program. This is an opportunity for students who are unable to attend one of our in-person information sessions to learn more about applying to our program. Before we cover the admission requirements, I want to share some quick facts about the University of Portland School of Nursing. We are the oldest nursing program in Oregon, and we were established in 1934. At the University of Portland School of Nursing, students will learn to view their patients holistically and to use clinical reasoning to facilitate health and wellness. Our program provides students with the opportunity to develop competency in the assessment, promotion, maintenance, and restoration of health. Transfer students begin in both the fall and spring semesters. The seats in the fall semester are guaranteed to our current four-year nursing students. Depending on how many of them do not meet the requirements by the end of their sophomore year, those are the seats that could potentially open up to transfer students. However, the number of seats will vary year to year. Sometimes we are able to bring a handful of transfer students into the fall semester. Other times we may not have any seats available. As a result, the majority of our transfer students will begin in the spring semester. The program is 5 semesters long, therefore it takes about a year and a half to complete the program. Our students will begin their clinical experiences after the first semester, practicing in our lab, which is a state-of-the-art model hospital and clinic used to prepare our undergraduate nursing students for practice. The lab consists of 6 parts: an acute care lab, an outpatient clinic lab, a classroom, and dedicated simulation theaters. The dedicated simulation theaters replicates an acute care patient room, an obstetrics patient room, and a pediatrics patient room. Our clinical simulations provide students with the opportunity to practice nursing care through realistic clinical scenarios utilizing human patient simulators and realistic healthcare equipment. What sets our lab apart from other schools of nursing is the similarity of our environment to that of actual healthcare facilities. This allows our students to transfer their learning from the academic lab setting to the bedside with increased skill and confidence. Once our students begin clinical, they will participate in a wide variety of clinical rotations, including medical surgical, community health, psych mental health, and obstetrics or pediatrics. Successful completion of the baccalaureate program will qualify our students to sit for the NCLEX-RN exam, and the average first-time pass rate on the NCLEX exam is typically 92%. Now let's talk about the admission requirements. In order to be considered for the Bachelor's of Science in Nursing program at University of Portland, you need to have a cumulative GPA of a 3.0 or above, a cumulative science GPA of a 3.0 or above, and completion of all prerequisite courses prior to entering the program. Do keep in mind that this is a competitive program, therefore the average GPA of the students that are accepted is typically a 3.5 cumulative GPA and a 3.8 in the sciences. You can also apply to the program before all of your prerequisites have been completed, and you will have an opportunity to outline your remaining requirements on the application. Every transfer student must complete the required prerequisite science courses. This includes anatomy and physiology with labs, microbiology with lab, and general biology. For general biology, we are looking for a course that covers molecular, cellular, and genetics. We do prefer 200-level courses, and oftentimes at various community colleges they may be offered as 1 or 2-part biology series. We recommend that you refer to the Bachelor's of Science in Nursing Course Equivalency Guide, which can be found on the University of Portland School of Nursing website to learn more about which courses would be transferable from local community colleges and universities. You also have to complete one chemistry high school or college level course. This will not be calculated into your science GPA. And you can always contact us for questions regarding which courses would be transferable. In addition, you must complete nutrition. We are looking for an introductory nutrition course detailing nutrients and how the body handles them. You must also complete a lifespan human growth and development course. You may want to refer to the Bachelor's of Science in Nursing Equivalency Guide because oftentimes this can be in the course catalog as a psychology course. We are looking for an introductory class that covers human growth and development across the lifespan, and it must cover theories of human physical, cognitive, and psychosocial development. And finally, you do have to complete a wide variety of prerequisite core requirements. These include 2 social sciences in 2 different fields, including interpersonal communication, economics, anthropology, sociology, psychology, and political science. Fine arts, which does need to be a class covering the historical aspect of architecture, cinema, music, theater, and visual art. Literature, history, statistics, introductory philosophy, ethics, and theology. The theology courses include comparative religions, which would cover both Eastern and Western religions, as well as Old New Testament. And once again, you can always contact us with any questions regarding these requirements. We do need to ensure that you are at a junior status or 60 semester hours completed when you start the program at the University of Portland School of Nursing. University of Portland is on the semester hour system, which does mean that if you are on the quarter system, you need to transfer in a total of 90 quarter hours. All courses must be at 100 level or higher. You must receive a grade of C or better in each one of the classes that you transfer to the University of Portland, and we cannot accept any courses that are pass, no pass. Some tips regarding the BSN application process include applying online and applying early. Due to the number of students that apply each year, it is recommended that you apply sooner rather than later. We typically have over 400 applicants for 60 to 80 seats in our program. There is space allotted in the application to outline your plan for completing all of the required prerequisites by the time you would start the program. Please continue to send updated transcripts to admissions as you complete courses to ensure that your file is as up to date as possible. Due to the large number of students that apply, we do encourage you to submit additional materials to help us get to know you. Please feel free to submit letters of recommendation, personal statements, and resumes. In addition, there are questions on the application that are geared specifically towards nursing transfer students. Please don't forget to respond to these questions. Again, if you have any questions regarding applying or prerequisites, please don't hesitate to email me at majorse@up.edu. You're always welcome to send me course descriptions or unofficial transcripts for review. I wish you the best of luck throughout the application process and hope to see you on the UP campus soon. And now I'd like to go ahead and turn it over to Heather Larry, our Providence Scholar Liaison.
Hi, this is Heather Larry. I am the current Providence Scholar Liaison between the University of Portland and Providence. So I'm going to talk now about the Prov Scholar Program. The Prov Scholar Program is a unique arrangement between Providence Health and Services in Oregon and the University of Portland. At any given point, we have about 40 Prov Scholars enrolled. The important thing about the Prov Scholar Program is that it is a scholarship loan program, and I'm going to tell you a little bit what that is in the next slides. But what this means to you, as a Prov Scholar, the University of Portland gives us a 25% tuition grant right off at the top. Then, Providence pays the remaining 75%. Upon graduation, you work for Providence anywhere within Oregon. And this is full-time for 3 consecutive years. You're going to hear me say this full-time 3 consecutive years several times as it's an important piece. As you work, your loan and interest is forgiven. You're paying taxes on the loan and interest as it's forgiven in equal installments every pay period. So let's talk a little bit about what this looks like. For simplicity's sake, let's assume tuition is $20,000. In that case, UP grant would cover $5,000 in the form of a grant. The remaining tuition would be paid, that must be paid, is $15,000. Providence would cover 75% of that, which would be $11,250. You'd have the rest. So here are some of the benefits of being a Prov Scholar. You have a significantly reduced tuition expense, as we talked about on the slide previously. You have a guaranteed capstone placement in a Providence, Oregon facility. That capstone placement is your senior precepted rotation where you work 180 hours, the same shift as a Providence nurse. The reason this is good is I'd say about 50% of Prof Scholars get hired on their capstone unit. That essentially will give you 180 hours to try on a unit before you get hired there. You have the services of the Prof Scholar Liaison. That's me. So if you decide you want to start grad school and you need a letter of recommendation, you can get one from me. Sometimes I have Prof Scholars who want to buy a home, and they have some weird home loan things. Their paycheck looks like they make more than they do. I can write you a letter. So it's nice to have me available to you. I also support you during nursing school. And one other benefit of the Prof Scholar program is, unlike other loans, you actually can pay this off early. So if for any reason you need to quit before your 3 years, you essentially set up a payment plan and you just pay off any part of the loan that hasn't been forgiven to date. So here's some considerations for you to think about as you're considering applying for the Prof Scholar program. First of all, you must work full-time for 3 consecutive years. That's even if you give birth, even if you fall in love and want to work elsewhere. Again, as mentioned on the previous slide, you're welcome to quit or go part-time, but you would then need to pay back any amount of the loan that hasn't been forgiven to that point. Another consideration is you will be placed somewhere in Oregon. This may not be on your desired location or unit. My statement is always Providence need trumps your desires. I have a lot of Prof Scholars who are from the Portland area and want to stay in the Portland area. Yet we have hospitals in Medford, Seaside, Newburgh, Hood River, and I can't promise you that you will not be hired in those locations. You're obligated to work at your first position for 18 months. So even if it's 13 months, you have an opportunity to take a residency in the ICU, which is where you really want to work. You're obligated to work at your job for 18 months, and I'm really a stickler on this. It's important because I want managers who hire Prof Scholars to be guaranteed that they're going to have you for at least 18 months. They don't have that guarantee with other new grads, so I really will hold you accountable to that. You also have to be able to secure employment within 60 days of graduation. Now, there's a little bit of a double standard here. I can't promise you that you're going to have a job within 60 days, but what I need from you is a commitment within 60 days of graduation you're going to be able to work. A lot of people after graduation go on vacation, they get married. There's a lot of things that you can do in 60 days. What you can't do is go on a 6-month walking tour of Europe. And one other consideration is you're going to have a tax obligation. This is going to cost you a little bit of money in taxes to be a Prof Scholar. Some other considerations is being awarded the Prof Scholar award may affect other aid grants and scholarships. Often at the University of Portland, being a Prof Scholar replaces any of those need-based scholarships and any UP awarded aid. So that includes the President's Award. So if you are currently a University of Portland student and you're receiving the President's Award, you would need to determine if receiving the Prof Scholarship is more beneficial to you than the President's Award. Do know that you do qualify for a federal aid and state aid even as being a Prof Scholar. If you're interested in federal and state aid, you need to submit a FAFSA by January 31st. If you have any questions about financial aid, go ahead and contact the UP Financial Aid Department. They can help you figure out if being a Prof Scholar will affect your other scholarships. So contractual obligations. These are just some of the obligations to be a Prof Scholar. You have to have successful progression in school. If you fail out of nursing school, you cannot sit for NCLEX and you can't work as a nurse. Therefore, you would need to pay us back anything that we've paid for your tuition up to that point. You have to be able to secure and maintain your RN license. I don't ever have any problems with Prof Scholars not being able to pass boards, but if that were to happen, you would need to, we'd give you a couple opportunities to take board, but after maybe 3-4 attempts, if you weren't able to pass, you couldn't work as an RN, you would need to pay back any of the loan that we paid. And then you need to work full-time for 3 consecutive years, even if your family lifestyle changes. Often the time I have the most challenge with folks wanting to move part-time is if they give birth and they want to go part-time. That is completely understandable. Providence understands and values the importance of family and children, but you do have a contract and it does say you'll work full-time for 3 consecutive years. So if you need to move part-time, you would need to pay back any part of the loan that hadn't been forgiven at that point. And finally, you have to maintain your employment with Providence in Oregon. Providence is actually a 5-state system, but it's Providence, Oregon who would be paying your tuition. Therefore, that's where your obligation lies. Every once in a while, we have circumstances where Prov scholars have an extraordinary event in their life and they need to have their contract modified. So I have had a Prov scholar who gave birth to a developmentally delayed child that required more parenting than she could work full-time. That was okay. We let her move part-time. We extended her forgiveness out. We've had a couple of occasions where Prov scholars have become gravely injured or ill to the point where they could not work as a nurse. In those circumstances, we asked them to write us a letter and request that the loan be forgiven. We were able to forgive those loans. However, the IRS isn't as forgiving. There was still a tax requirement as part of that forgiveness. So here are your tax considerations. The money Providence pays you for your education will be reported to the IRS when it's forgiven. So it's not while you're a student, it's after you've been employed. Basically, we report that forgiveness in equal installments every 2 weeks aligned with your payday over those 3 years that your Prov scholar forgiveness is being forgiven. And you pay taxes on that money as if it were income. So your paycheck looks like you received more money than you actually earned. So an example is, say your paycheck, you gross $2,000. And we forgive $800 of your loan, it looks as though you made $2,800. You're paying taxes on $2,800. So that will impact you financially. Taxes vary significantly based on marital status, your base pay, differentials, incentives, and if you participate in 403. That being said, Prov scholars can expect to pay $5,000 to $6,000 a year more in taxes than non-Prov scholars. So bottom line, over 3 years, this will cost you somewhere between $15,000 and $20,000 in taxes to be a Prov scholar. Something important to note is you will apply for the Prov Scholar program concurrently with the School of Nursing. Every year I have somebody who thought they needed to wait until they got accepted into the School of Nursing before they applied to the Prov Scholar program. They lost the opportunity to participate in the Prov Scholar program. So apply to the Prov Scholar program the same time you're applying to the University of Portland School of Nursing. Also, something to pay attention is the Prov Scholar program's requirements are a little more rigorous than the University of Portland. In order to be considered, you need to have an overall GPA of 3.25 and a science GPA of 3.0. So on the screen, you'll see the electronic application process, the address where you go to apply to the Prov Scholar program. Tips for a competitive application. So my first recommendation to you is to go online and look at the current Prov Scholar application. With the exception of demographics and a free text box at the end, everything on that application is scored. So your GPA, your science GPA, your leadership, your volunteer hours, your Providence employment, if you're a direct family of a Providence employee, all of those things have a score applied to them. So the things you can do is go and look and see if there's anything you don't have. Now, one of the things that's very challenging for anybody to get is the management. Management is defined by a role where you hire, fire, schedule, and do performance evaluations. Very few people have the opportunity to do that. If you do, you're going to get some extra points. Things you can do, however, is leadership role. So this is an official role in a formalized group, say a president, vice president, board member, treasurer, secretary. of any group like the PTA, Key Club, your local kayaking club, the YMCA, basically anything where you have a formalized role, that's considered leadership, and it's the last 5 years. So often, as a senior in high school, you were the president of the Key Club, and 3 years later you're applying to the Prof Scholar Program. That would qualify. So volunteer hours, all of those are things that you can do now. Now, that being said, know that your GPA and your science GPA are very heavily weighted in this. So if you have the opportunity to get an A in microbiology or volunteer for 20 hours at the Humane Society, I say work on that A. That's the most important piece. On this screen, you'll see my contact information. You'll see both my phone number and my email address. If you have any questions about the Prof Scholar Program, if you'd like to have a copy of this presentation, please feel free to contact me. My email address is probably the best way to get me, and that's heather.larry@providence.org. Feel free to call me, but I'm not going to get back to you quite as quickly as I would with email. Thanks, and I'm looking forward to meeting you.
We are a diverse and innovative community who embody a passion for the profession by educating transformational leaders who intentionally practice the art, the science, and the essence of nursing.